Hi, my name is Kathleen, and I'm here with my son Thomas. He was diagnosed when he turned 2 as a moderate autistic. Since then, it has changed. His diagnosis has changed to high-functioning PDD. How did we get there? We got there using various therapies like ABA, speech therapy, OT, and PT. We also do a host of supplements. He's on the GFCF diet. He's soy-free, corn-free. And we also do the methylcobalamin shots. Our journey to the methylcobalamin shots began at the April 2004 DAN conference. I was present, and I was lucky enough to hear Dr. James Neubrander present on the methylcobalamin shots, and I got very excited, and I called my husband and I said, this is something that we need to do for our son. And my husband said, come home and talk to me about it. And when I got home, we talked about it, and he was not interested at all. My husband didn't want to do anything so invasive as shots. I was disappointed, and then confronted with his doubts, I became very doubtful too, and I started wavering, and I started thinking, has it really come to this? Am I really going to, do I really want to shoot my son full of something? And what if it doesn't work? What am I going to do then? What drastic measure am I going to do after that? And so, we lost some time. We just decided not to do anything for a while. But what happened for me is that there was another child in my son's school at the time in early intervention, and his parents decided to do the shots. And every day or every couple of days, his mother, who has become my friend, has said to me, he's doing this now, and we see this, and we see this change, and this is going on. And I got really excited again, and I was convinced at that point that that was the right thing for us to try, because Thomas was sort of leveling out on the treatments that we were using for him, and I felt that he was capable of more. So I came home and I really insisted, and after, a couple of weeks, my husband finally said, okay, you've convinced me, let's give it a try. So we made an appointment, we saw the doctor. A couple of days later, we got the shots. When we got the shots, I got very scared, because I knew I was the one that was going to have to give my son the shots. And I get even shaky now thinking about that moment when I took the syringe out, and I thought, oh geez, I'm the one, I was the catalyst for this, and we're going to have to do this. But when I looked at the syringe, I saw that it was kind of small, on the smaller side, and I took the orange cap off, and the needle was very small, and I saw that the fluid inside was like a pinch of fluid, and so I knew, that with being a short needle, it wasn't going to hurt him that much, and at least I hope it wouldn't. And since there wasn't a lot of fluid, it would just be in and out so fast. And so I knew that it was basically based on my technique whether or not, he was going to feel anything. And to be honest, my technique isn't so good yet. So every once in a while, when we give Thomas the shots, we've decided, first of all, that because of his sensory issues, we do not use the EMLA cream. And that is because he doesn't tolerate creams, and he doesn't tolerate Band-Aids at all. So we've done the shots just basically when we're getting him ready for bed, when we're changing him, we just roll him over and boop, we stick it right in there. His reaction every once in a while is he says, oh! He doesn't cry out in pain, he doesn't scream. And as you know, with a child on the spectrum, a lot of them are emotionally delayed. And so when a baby feels pain, a baby screams. And Thomas, being a little babyish, he doesn't scream. He says, oh. And what we get from that is that it's not a severe pain for him. What it is it's a pinch, maybe a little prick. It's not something, he's not suffering, and we're relieved to know that. When we started giving Thomas the shots, we noticed two things right away in his response. First of all, his eye contact was incredible. It hadn't been before. He used to completely ignore us when we called his name, and now when we call his name, he comes, he looks at us, he establishes eye contact with people, and that's a huge plus. We also found that he was a lot more aware of houses, trees, airplanes. He was aware of his sister for the first time. She was just really a non-entity before the shots, and now after the shots, she's become a part of his life. Other things that we've noticed is his receptive and expressive language have increased quite a bit. He knows what we're saying to him, and he comments on things. He brings us things, and he says, "Yellow truck, big yellow truck." And so that's a huge plus. We've also seen his physical capabilities have increased. He's no longer a floppy child. He can run and he can climb ladders. He bounces balls. He's got a lot of sensory improvements. He was very, very sensory, and now he can tolerate sand. He can tolerate water and washing his hands, and he can tolerate brushing his teeth, which was something that he couldn't do before. He is better transitioning. By far, his transitioning has increased. He can now go from the car to the store. He can stay in the store. He can be in the carriage in the store. He can go and do things that we weren't able to do before, and that's been a huge plus. Some of the downsides have been his stimming has increased quite a bit. It got really bad when we first started the shots, and now it's decreased a bit, but he still remains stimmy. The good part in that is that we can redirect him when he's stimming, which is something that we were not able to do before. But he's still very stimmy, and we don't know how long we're going to have to live with that, but we have to live with that for now. He also is jargoning a lot. And if you don't know what jargoning is, that is where he memorizes a show, a portion of a show, like Kipper or Caillou or Bob the Builder, and he keeps repeating the same scene over and over again. Like he says, "Hello, Kipper," and "Mommy, Daddy," like Caillou, and then, like Caillou says, and he'll even mention the word Caillou, or he mentions Kipper, and last night he was talking about, Bob the Builder, and so instead of having meaningful conversation with us, he's jargoning, and he's saying, I walk in the room and he says, "Hi, Kipper, I'm Mama," and he did know me as Mama, and when he can call me, he'll say, "Mama, I want my juice," but if I walk in the room and he's not expecting me, he'll say, "Hi, Kipper," and go into his little jargon routine. We also have noticed that his sensory issues are not gone. He still has them. So he's still tactile defensive. He doesn't tolerate foods still. We're having difficulty feeding him still. He doesn't like cold food. He doesn't like wet food. And, these are things that have not improved, and we were hoping for more of an improvement in those areas, but we haven't seen that. He's also, although he's not hyperactive, he's close to it. He's a very high energy boy. This is Thomas, and he's extremely high energy, and I don't know when that's going away. Maybe never. I really don't know. But the impact that the shots have had on our lives is immense. He seems to be, more of a typical boy. He acts like a 2-year-old boy. Maybe in some areas not as high functioning, like language and so forth. But when we bring him to the playground or we bring him to the zoo or something, people don't know right off the bat that Thomas has issues. And that's been a comfort to us because, you know, you don't like it to be so obvious. You don't like to feel like you owe people an explanation for the behavior. And what's really excellent is that we've also been able, because of his improvements, we've been able to do more typical family functions. We go to the zoo, we can go to the playground, we can go to the amusement park, we could go to family functions and parties, and he doesn't have the transitioning issues, and he doesn't have the tantrums, and, you know, it's just a smoother ride for us when we do things like other families do. And for a while there, we were just kind of stuck in the house. We knew we couldn't bring Thomas because, well, maybe we just didn't feel like dealing with the problem that would come up, and you know, in the transitioning or the screaming and the tantrums, and sometimes we just didn't feel like dealing with it. And now, you know, we still have those issues. A lot of families have those issues, even families who were not on the spectrum. But they've become less and less, and that's been a big bonus for our family. And we feel that the methylcobalamin has contributed to that. We're not saying that his other therapies haven't contributed. We think that the methylcobalamin has supplemented positively the other therapies that we're doing for Thomas. How will you know that it's right for you? The only way you know that this treatment is right for you is if you give it a try. I didn't know that it was going to be right for Thomas. We don't know no one knows if your child is going to be a responder unless you do the treatment for your child. We took a chance. I felt in my heart that this was something that I wanted to do for Thomas. I convinced my husband. We did it, and we were lucky. Our child responded. And we're aware that there are families out there that the children don't respond, but we got lucky. And the only way we knew how lucky we are right now is because we gave it a try. And I guess what I'd like to say to you is that, you know, my husband and I know that, you know, we can't tell you what to do with your family. We make the decisions for our family, and but we're aware that those decisions that you have are very tough. The children on the spectrum are all different, but we have similar decisions to make in treatment options and schooling options. But they're similar, and they're all very difficult, and they're tough, and they're decisions that we have to make. And methylcobalamin is a treatment option, and we feel that it's one that's worthy of your attention. We think that you should consider it. We're very blessed. We're blessed because we found methylcobalamin. We're blessed because we decided to give it a try, the shots, that is. We decided to give the shots a try. And Thomas was a responder, and we're really lucky and we're blessed for that. Methylcobalamin is a really viable treatment option for children on the spectrum, and you should give it a try. You should really give it a shot for your child.